say some days you're gonna win. They say some days you're gonna lose. I tell you, I got news for you. You're losing all the time, you never win. No.
Welcome in as we start our week on RiverBender.com and Roku TV, Apple Podcasts, with a different broadcast for all of you today. I'm not in the studio. I'm here at OSF Healthcare right here at St. Anthony's, and I'm gone. I have a really important date that we've been talking about for quite some time, and I'll fill you in on what that event was tomorrow. But on Thursday at 2 p.m., we had the opportunity to celebrate with OSF Healthcare 100 years. Think about that. 100, providing the best healthcare and the greatest services right here all across the 618. OSF Healthcare joins us live on the show so many times throughout the month and throughout the year, and we get to talk about all those innovative approaches, all those new additions that have come to St. Anthony's and OSF across the board, and I think that's such a really, really important note. You know, just like this year, OSF Healthcare had the opportunity and earned every bit of it with that Magnet of Distinction Award, and just things like that. So today we're going to be talking to so many wonderful folks from OSF Healthcare, some of the folks that make up the great services at the hospital, and just some more on this Monday morning for you. This was taped on Thursday, but it's brand new to you. More from OSF Healthcare happens next.
Throughout all life stages, you need someone in your corner, guiding you on your health and wellness journey. At OSF Healthcare, that's your primary care provider. Your OSF primary care provider is there for every stage of life. Find a provider today at osfhealthcare.org/primary.
Not sure if you've noticed, but those advertised prices from the other dealers are just a bunch of blah, blah, blah. At Roberts Motors, the advertised price is the price you pay. And that, my friend, is great news for you. Don't fall for their so-called incentives that will leave you banging your head against the wall. Go with Roberts Motors. Prices you can trust and people you will like. That's the Roberts Motors way. And trust me, it's the way to go.
Has free checking become a thing of the past? Not if Liberty has anything to say about it. With 3 free personal checking options and even a free business checking account, free is alive and well at Liberty Bank, the local bank that gives you free checking choices and more cashing in your pocket. Bank locally, bank Liberty. For more information, visit www.bankliberty.com.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Welcome back to your Monday morning broadcast of Our Daily Show, but we're live on a Thursday right here at OSF St. Anthony's Health Center, 100 years.
Yay.
This is incredible, and I just think it's fantastic to see everyone on display and just really having a great time. Sister Beata
Yes.
Ziegler,
Mm-hmm.
did I do it perfectly?
You did.
Oh, see, I told you guys we're getting better at this.
Mm-hmm.
Sister's been on the show before if you're just tuning in, and that's been kind of our inside game for the last couple of interviews.
Yes.
Well, sister, you've got to be excited about this. And just for me setting up and just seeing a few of the folks getting ready, there's just so much passion and pride that goes into all the services and all the departments at OSF.
Yes. I mean, all of our mission partners really believe in our mission. They love it. They know we're caring for patients, those at their weakest times, and so their heart is completely in it.
Well, and two, it's a testament to how good your staff is overall at OSF because you're able to put on an event like this, open to the public, and continue the operations of the hospital.
Yes. I mean, it would have been great if we could show every internal working of the hospital and the equipment, but we also wanted to continue our patient care. So we're in general areas
I
today.
forgot to ask you, how long have you been at OSF?
I have been here for almost 6 years.
And take me through the 6 years that you've been able to experience here at OSF and just your takeaway from it.
Well, I started in January of 20.
Oh, fun year to start.
Fun year to start. And I tell you, that was the great year of leveling because I had worked in nursing home work at our nursing home at Mother Good Counsel Home in St. Louis.
Okay.
So I had that perspective on healthcare, but coming into a hospital, it is different. But with COVID, it was different for everyone. And so I got to know all of the leaders so quickly because we had to figure this out. We had to figure this monster out. So that really was the first couple of years. And then as I have grown through my role, taking on more responsibilities, really the last piece that I have taken under my purview is imaging and laboratory. So more clinically focused areas, which has been really special for me.
Well, and I think that's something great just to talk about with the folks at home, just to get some of that insight behind the scenes. And even, too, before we came on and started taping this segment of the show, we were just talking about some of the new additions that the Sisters of the Martyr St. George, correct? Oh, goodness. I'm getting good. I didn't have any notes of this. Remember when we first started talking?
Yes. I was like, what's the name? Yes.
But, it's when you have the Sister of the Martyr St. George, you have these additions. I mean, it's really promising, and it's kind of just cool to hear how, someone gets started, and really just begins their journey, and it's just so cool.
Yeah. On September 8th, we had 5, and then just a couple weeks later, our 6th new postulant enter, which is just a blessing. God has really, this is a gift this year. And I am lucky because 2 of them help serve in the mornings here at St. Anthony. So they have helped me put a lot of this together.
Well, and, it's got to be exciting, too, to see the new faces and the next generation, coming in as you're celebrating such a monumental milestone with 100 years. It's such a cool little history and almost a bittersweet component on it, too, where you're seeing those next generations. And 40 years from now, they'll be the ones handing it over to somebody new.
Yes, absolutely. And that's what the beauty of this year is, being able to look back, but then look forward to the future.
Well, and this year, before we talk about the future and talk about today, I mean, a huge acknowledgement when you get the magnet with distinction designation. I mean, 1 in 46 hospitals around the world.
Yes.
This is incredible. And it's right here in our own backyard, and that's something that we should all be really proud of.
Yes. The quality of care that we provide here at St. Anthony's is really stellar. It's the love of the patients coming through, and I think it just really puts a cap on this year.
Well, and now today, obviously you guys can't come in Monday today when we're broadcasting this to OSF, but on Thursday, October the 23rd, we are part of this open house. And what can folks experience, just today in the next couple of hours as they're stopping on in and getting to experience OSF?
Well, so we have a welcome area where folks can pick up. Throughout the health center, we have candies from the 1920s.
No kidding.
This is something they did at the golf tournament, and it was
That's
really
so cool.
fun. So it just kind of brings back some old memories of growing up. And so at each of the stations, they can pick up whatever that candy may be. We also have a spin the wheel, and we have all kinds of OSF gear, Jubilee items, and things like that. So you can win something there. We have religious goods, we have holy cards, and fun stuff like that too. And then they get their little passport, and they go place to place, and they see all the different departments. Oncology, our primary care, our specialty care groups, learn more about the physicians, our on-call digital care and psychological services. We have fall treats. We have a candy apple bar.
I heard about that.
Yeah, you're going to have to get some of that because it looks really good.
Well, and there was also, I was hearing some of the stationing that was going on between the sisters and getting out there to their spots. That's how I heard about some of the inside scoop today.
Yes. We have volunteers. We have sisters at all these locations. And I really hope the community comes out and sees the sisters maybe they worked with years ago.
Yeah, well, and also maybe they worked in that various department years ago. And to see how it's grown and just to see how it's evolved. And, I talk about it all the time, but when you add the additions to the wound care clinic and all of the things with the Muller Cancer Care Center and everything with psychological services, it's something that we would have had to have waited a long time for, number one, to schedule, to drive hours back and forth to appointments, and now to have this all collectively under a great health organization in our own backyard is just priceless.
Yes, absolutely.
Well, sister, I know that you're busy today, and I got to let you get going here soon. What's your final takeaway, though, just to the community over 100 years with OSF?
Just to the community, thank you for your support through these years and for entrusting yourselves to us at St. Anthony's when you were hurting and needing that special care. that love and that really quality service, because we are here to stay, and we are very excited to continue to serve you into the future.
Absolutely. Sister, thanks so much for stopping by.
Thank you so much.
More
CJ.
of our coverage from the 100th anniversary open house at OSF St. Anthony's Health Center. It continues right after this on RiverBender and Roku. With over 20 years of experience, Wilson's Tree Service has the expertise to handle all of your tree care needs. Licensed and fully insured, their team of experts are dedicated to providing reliable service. Plus, with a 24-hour emergency service line, Wilson's will always be there for you. Don't risk tackling that timber by yourself. Trust the local professionals at Wilson's Tree Service. Visit treeservicealtonil.org to get started today.
Discover Del Mar Public House, located in Godfrey's historic Clifton Schoolhouse. Enjoy bold flavors like homemade falafel, fish and chips, and rotating pasta favorites. Relax with local beers, half-price wine bottles, and summer poutine nights. The only thing missing is you. Open Wednesday through Sunday. Del Mar Public House, where great food, drinks, and friends come together. DelMarPublicHouse.com.
Do you need to declutter your space? Time to call me, the Queen of Junk. Since 1993, we have grown to be the leader in residential, commercial, and property management junk removal. At Sparks Junk Removal, we are eco-friendly. We recycle, donate, or repurpose items back into our community. Trash is our last resort to the landfill. Plus, with our all-inclusive service, our crews handle everything from labor to lifting and landfill fees. Give us a call or visit our website, sparksjunkremoval.net, to reclaim your space today.
When I got in the car accident at the ER, they gave me a prescription of hydrocodone. And over time, it took more medication to mask the pain. I moved over to drug seeking and found heroin and fentanyl. I went to the Centerstone rehab facility, and it was the best decision I ever made in my life. I have my own car, I have a job. There's nothing holding me back anymore.
When you need a project done right, on budget and on time, trust Gillahan Concrete. Gillahan handles every kind of project, big and small. Commercial, industrial, residential, from room additions and garages to patios, driveways, and more. Gillahan brings quality and experience to every job. Family owned with over 30 years of service to our community. Call today at 618-781-3914 or visit GillahanConcrete.com.
Accidents happen in a heartbeat, but lives change forever. Whether it's a car crash, workplace injury, medical malpractice, or wrongful death, you don't have to face the consequences alone. Keith Short and Associates brings over 33 years of experience and a reputation for fighting fiercely for your rights. For relentless representation that you can trust, call Keith Short and Associates at 618-254-0055 today for a free consultation.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
We were running against the wind. We were young and strong. We were running against the wind.
Welcome back to Our Daily Show. Monday morning continues, but we're here on a Thursday at OSF Healthcare, the 23rd of October, as we're celebrating 100 years. That's 100 of OSF right in our own backyard. And Dana, you've been with oncology now, especially here at OSF, for 5 years, correct?
Yes.
Well, and it's got to be just a really exciting time to be here. Number one, a milestone with 100 years, which is huge for any organization. And then you're coming off the heels of the Magnet with Distinction designation, which is just incredible. One of only 46 hospitals in the world have this.
Yeah, and to get with the distinction is an extra. Yeah,
it's just incredible.
Yeah, yep.
Well, take me through your team at oncology. What makes your group just such an efficient team?
I think really just how well we work as a team. I mean, we collaborate so well together with everywhere with us in general over at the hospital. Really just patient care to get them in, get them treated fast, get them worked up fast. It's really our team approach to get the best care with the patients.
Absolutely. And, today being able to kind of just relax a little bit in a way, you're still obviously a functioning hospital, so there's still tasks at hand. But to be able to showcase the department a little bit and just kind of have that let down the hair moment, working with the team, what's that like for everybody in there?
Very collaborative. I mean, we have a lot of, different kind of like with our services and stuff that you're meaning.
Yeah.
So we have medical oncology with Dr. Sandu, and then we have radiation oncology with Dr. Pehoff. We have hematology, so we have 2 nurse practitioners. We have infusion services. So really just an overall team approach of starting at one point and working your way through the whole center and getting you where you need to be.
Well, and I think that's really important too when we come in and just meet with some of the folks as we did, this Thursday. It's just good to get a little bit more of that in-depth of just all the other spokes that are on that OSF wheel and that web of services that you guys surely provide.
Yeah. And then having our low-dose CT clinic that we newly started, kind of getting that up and going with March, working with primary
Was
cares
that
on
in March when that started?
It was, it was around March. We were going to in January, but it was more around March, I think, when we fully got going with it.
How has that process been? How has it been since it's been?
It's been good. We're getting over that, with the referrals through the primary care and then us kind of managing it after that initial, the flow's going with it. We're getting some self-referrals. The process with it is going pretty well, yeah.
Well, and now, what is a low-dose CT, just to refamiliarize our audience a little bit?
So a low-dose CT is a CT lung screening, but it's a lower dose of radiation, and it's basically to pick up anything sooner, watchful waiting, anything that might pick up a spot on your lung, anything incidental, it can pick up anything abnormal, like if there's, say, on your kidney or your thyroid, but it's a lower dose of radiation, and it is essentially like a screening, like other screening tests you get done.
Well, and when it comes to, oncology and really just, some of the cancer coordination that takes place with the patients and their families, the wraparound approach, I think, is what makes you guys stand out so much more, is you aren't just taking that patient on the journey, you're taking that family with them too, and saying we're a team and we're going to get through this together. And I think that's a really important point to make.
It is. The patients' family members are just as much a part of it and the caregivers as the patients. I mean, really, it's everybody's journey kind of together, and us right along with them.
100%. Well, and now, what is one thing you want the public to know about just within oncology and some of the services you provide that maybe don't get talked about as much as they should?
Probably really just our VAS with our infusion services is huge, because it is the chemotherapy side of it, but then just our outpatient side of it too. We take a lot of outside orders, doing just regular people with immunocompromised, or people with rheumatoid arthritis, or do a lot of iron infusions. We do a lot of outside injections that primary cares might refer for osteoporosis and such.
Do you see, not to cut you off, do you see a lot more of the infusions and more of that work being done now with low iron counts or maybe just low testosterone? Does that take place in that same type of function?
Yes.
Really?
Yeah, we get a lot. Like, there is a lot with the low iron. We see that a lot.
Is that just because more testing's being done now, or is that just because of maybe what we're eating and all of that?
Probably
Sorry to put you on the spot.
No, I would say probably a little bit of both. I mean, our diet's obviously ever-changing, and you're not getting as much of that in with your diet, but then also just more active testing. Patients may be coming in symptomatic, and it's like, okay, let's check your iron, and then referring into us for hematology.
Well, and now that's really why I like having OSF on too, is because how many times do we just have these subtle conversations, maybe it's not, a full-blown, here's my symptoms, but I've been really sluggish lately, or I'm not, I'm not
those vague symptoms,
and we talk about it in the office or with our neighbor, but when we can talk about them on the show, hopefully it spurs somebody to go, well, you know what, I'm not going to call my primary today to at least get started.
Yeah, because so many times you're thinking, oh, it's nothing, but those vague symptoms sometimes can be something, and just get checked out.
And we're all the same people, I feel like, when it comes to this. We force everyone else to go to the hospital right away.
But
Mom, Dad, you got to go, but we'll go in a couple of weeks.
Yeah, we'll take care of it later, But don't, and that's the big thing kind of with the screening side of it. Is get your screenings. Just get yourself taken care of.
Well, and now, upcoming screening opportunities, do we have any on the top of our head?
We don't have any. I don't think we have another prostate one or skin one scheduled as of yet, but normally the skin one we always kick off a lot in the summertime with that. The prostate one I think we just did in September, so we'll have that more up and coming with summertime,
Really cool. Now, before I let you go, what are you looking forward to the most with the open house?
Hopefully just a good turnout, seeing everybody walking around, checking all the services around, and just having a good time, and celebrating our 100 years.
Dana, thanks for stopping by.
Yep, thank you.
We'll take a quick break. We'll come back with more of our coverage of the open house celebrating 100 years of OSF St. Anthony's right after this on RiverBender.com and Roku TV.
Throughout all life stages, you need someone in your corner, guiding you on your health and wellness journey. At OSF Healthcare, that's your primary care provider. Your OSF primary care provider is there for every stage of life. Find a provider today at osfhealthcare.org/primary.
Not sure if you've noticed, but those advertised prices from the other dealers are just a bunch of blah, blah, blah. At Roberts Motors, the advertised price is the price you pay. And that, my friend, is great news for you. Don't fall for their so-called incentives that will leave you banging your head against the wall. Go with Roberts Motors. Prices you can trust and people you will like. That's the Roberts Motors way. And trust me, it's the way to go.
Has free checking become a thing of the past? Not if Liberty has anything to say about it. With 3 free personal checking options and even a free business checking account, free is alive and well at Liberty Bank, the local bank that gives you free checking choices and more cashing in your pocket. Bank locally, bank Liberty. For more information, visit www.bankliberty.com.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Hey, me, what you wanna do?
Welcome back as we are continuing our coverage live from OSF St. Anthony's Health Center here in Alton. 100 years and their open house celebration takes place on Thursday, October the 23rd. We're running the show for you on Monday because, well, we had a pre-planned day, and I figured let's give OSF the prime time hours of Riverbender's broadcasting time here. No better time to talk about on-call because, to be honest with you, we have had on-call commercials on our show for so long, and there's still so much more to learn about what on-call is all about. And Holly, you've been here since 2020 in this department. Fill me in on just number one, what OSF on-call is, and just how it's grown since you've been around.
Of course. So I've been around, like you said, in 2020 in this department, and it has expanded tremendously. There's a clinical side and a non-clinical side. So what we do as digital health navigators here in Alton is a variety of things. We have our Connect on the Go van. We take it out in the community and provide free health screenings.
Is that what that is?
Yeah. It sure is.
This isn't me playing with you at home. I have wondered for months now seeing this, and I'm like, I'll ask Randy and the team when they come on for the show, and never do. I'm glad we figured it out today.
That's right, yeah. So we take it in the community. We do free health screenings to anybody who's 18 and older. So those are things like cholesterol, blood pressure, oxygen, different things of that nature.
Does it ever surprise you the amount of people that, number one, don't have a primary care provider, and then number two, that should be getting screened or some type of those, preventative steps, and they just haven't done those? Is that alarming?
Of course, very alarming. And a lot of times, we're out in the community offering these free services, and maybe somebody comes along and has really high concerning blood pressure or some other things, so it's super valuable to help guide them and encourage them to locate a primary provider and get connected. So we try to do that and help them along the way to get connected to our services. But yes, definitely agree.
Well, and now with on-call too, take me through the virtual part of things, because I know you said there's a clinical side as well. When did that get added to the Rolodex?
So I feel like that was kind of always there, and our role as the digital health navigators kind of came second, as they call us more of the boots on the ground.
Yeah.
So there's a lot of clinical programs. There's programs to help support pregnancy and postpartum, just general health and wellness, chronic conditions. So we are, for instance, for the program that we call On-Call Advanced Care, we're going into the homes of patients and we're providing them a tablet, a blood pressure cuff, a pulse ox thermometer, and they are able to connect with our clinical side, and they provide that oversight. So it doesn't replace their provider, but it gives an extra layer of support and someone that they can communicate with daily for any needs or concerns that they have.
Do they need to have a home health aide or a nurse or anyone to provide, with the blood pressure cuff to provide that, or can they have a loved one or a guardian, or anyone else in their household provide that service with them?
They can have anyone they choose to help. So,
Okay,
if
perfect.
it's their spouse or someone of that, whoever really can help. And we do, take extra steps to make sure that the patient is very comfortable with using it themselves and go back out to troubleshoot and help if needed.
You would know more about this than I would, obviously, because you're in it all the time, but it seems like the advancements not only in healthcare haven't just been with additions, obviously, with what OSF's done, but also just like what you said, these devices are becoming so much easier to utilize and easier to navigate.
Right.
That's really cool.
Yeah, and one thing, too, kind of going back to the van, in addition to those free health screenings, we offer virtual visits.
That's what I wanted to ask you about, because this is where I get kind of confused. And not because it's confusing, but just because it's making my brain make sense of just how innovative this is. So when we do these virtual visits, just break them down for me to see if maybe that'll help me understand better.
Yeah, so anyone can come up to our van in the community if they have a need such as flu symptoms or an earache, something that they would go to a physical prompt care location to be seen for. We can see them on our van. We have very advanced technology called TIDO, and it allows the provider to see them in real time. We act as kind of the guidance support for the equipment, I would say. So we can listen to their heart, their lungs, look in their throat, if they have a rash on their skin, look in their ears, and the provider on the other end hears and sees that in real time to be able to diagnose and help the patient. And then if the provider feels like the patient should be tested for flu, COVID, or strep, we can do that right from the van as well.
Fill me in, too. It leads into this next one, and that's with this minor illness but the major convenience portion of on-call. Is it kind of similar to how an urgent care would work, like your prompt care office on Godfrey Road?
Yes. So the virtual urgent care itself, you can pay $30 or $60, and you can do a symptoms questionnaire. So just kind of filling out some questions on what's going on, and a provider will get back to you. Or you can choose to do that virtual video visit where you're seeing them, face to face through your device. And just like, going into the prompt care, they can see you for certain things that are able to be addressed through that means, prescribe your prescriptions from there and all that sort of thing. And it's just very convenient because if you're not able to leave your home or, transportation is an issue, mobility. And the cool thing, too, is they're available 24/7.
That's incredible. Well, I think it's really let me ask you this just about the urgent care. Is it one of those where we should, because there's so many times where, we haven't maybe felt right with like a sinus infection for a few weeks. Is it one of those where is that the opportunity to use that virtual, or should we go in and see somebody? If it's one of those kind of, it could be sinus, it could be this, maybe I have a sinus infection, maybe it's a virus. When's the proper time, do you think, to utilize that virtual component than maybe just popping into prompt care?
I would say the convenience factor.
Gotcha.
If you can't get there, or if it's like, okay, I've been dealing with this for 3 weeks, and now it's to the point I can't take it, but nobody's open except the emergency room. That's a great time to use that service. But I myself, for instance, like after I had my first daughter, I had a sinus infection. And I'm like, I don't want to go in. I know this is progressing, and I was able to use that service and see that virtual provider and get some medicine to help me.
Well, and so many times I hear that same conversation because it's like, I know that we need to go get looked at, but I'm only fighting this sinus infection, and give me a couple of more days. I don't want to go get sick at the waiting room,
Yes,
really
especially
cool.
I find it really valuable, for having a baby, because that was during the pandemic, and I didn't want to take my newborn into a sick waiting room. So that was a super valuable, offering that I took advantage of because it was perfect for that situation.
Let me ask you about Silver Cloud real quick, too. This is really, I've never heard about this component of on-call. Fill me in.
Yeah, so Silver Cloud is for mental health support. It's an app that anyone 18 and older can utilize for free, and it helps with there's a QR code in our brochure, and we do have our website that people can get connected to the Silver Cloud website, and they create a free profile, answer some basic questions, and that will lead them to maybe a combination of depression, anxiety modules, and support would be the best fit for them. They work through it anonymously for 8 to 10 weeks, and they have someone that checks in on them through the program. But it's a great tool, great resource.
And this is free?
It's absolutely free.
That's great for the public to know.
It sure is.
Man, that's wonderful. And one more thing before I let you go. You're always great with OSF On Call to connect us to resources, and there's quite a gauntlet of different things that you could help us with. Can you fill me in on some of those?
Yeah, so we do a lot of what's called SDOH. It's a simple questionnaire that we just walk through with patients. Helps to identify those non-medical needs that could be impacting their life, their health care, everything. So that could be from housing to food insecurity to transportation to maybe difficulty paying utility bills.
Oh, yeah.
So our team goes out in the community and really connects with organizations and places that offer resources to best know what's out there and what's available. So when we're talking to a patient and they might have some food insecurity issues going on, then we can speak directly to like, oh, I know in your area just down the street, there's a food pantry, and just work to connect them to meet their needs the best that we can.
That is so cool. And what's the best way to learn more about On Call, get connected, and really see if we can start utilizing all the benefits that it has?
Yeah, so we have our website, which is OSFOnCallConnect.org, and then we also have for that those resources I was talking about, we have our general line for our digital health navigators, and that number is 309-886-4200. That will get you connected with anybody on our team that can help with any of these services, whether they're trying to get connected to resources, they want to get enrolled, maybe some more information on SilverCloud for that mental health support, or to find more information about the van, they can call and ask us anything on there.
It's fantastic. Well, thank you so much, Holly, for stopping by and filling us in. It's a pleasure talking to you.
You as well. Thank you.
We'll come back with more of our coverage from the 100th anniversary open house celebration for OSF St. Anthony's right after this on RiverBender, Roku TV, and Apple Podcasts. With over 20 years of experience, Wilson's Tree Service has the expertise to handle all of your tree care needs. Licensed and fully insured, their team of experts are dedicated to providing reliable service. Plus, with a 24-hour emergency service line, Wilson's will always be there for you. Don't risk tackling that timber by yourself. Trust the local professionals at Wilson's Tree Service. Visit treeservicealtonil.org to get started today.
Discover Del Mar Public House, located in Godfrey's historic Clifton Schoolhouse. Enjoy bold flavors like homemade falafel, fish and chips, and rotating pasta favorites. Relax with local beers, half-price wine bottles, and summer poutine nights. The only thing missing is you. Open Wednesday through Sunday. Del Mar Public House, where great food, drinks, and friends come together. DelMarPublicHouse.com.
Do you need to declutter your space? Time to call me, the Queen of Junk. Since 1993, we have grown to be the leader in residential, commercial, and property management junk removal. At Sparks Junk Removal, we are eco-friendly. We recycle, donate, or repurpose items back into our community. Trash is our last resort to the landfill. Plus, with our all-inclusive service, our crews handle everything from labor to lifting and landfill fees. Give us a call or visit our website, sparksjunkremoval.net, to reclaim your space today.
When I got in the car accident at the ER, they gave me a prescription of hydrocodone, and over time it took more medication to mask the pain. I moved over to drug seeking and found heroin and fentanyl. I went to the Centerstone rehab facility, and it was the best decision I ever made in my life. I have my own car, I have a job, there's nothing holding me back anymore.
When you need a project done right, on budget and on time, trust Gillahan Concrete. Gillahan handles every kind of project, big and small. Commercial, industrial, residential, from room additions and garages to patios, driveways, and more. Gillahan brings quality and experience to every job. Family owned with over 30 years of service to our community. Call today at 618-781-3914 or visit GillahanConcrete.com.
Accidents happen in a heartbeat, but lives change forever. Whether it's a car crash, workplace injury, medical malpractice, or wrongful death, you don't have to face the consequences alone. Keith Short and Associates brings over 33 years of experience and a reputation for fighting fiercely for your rights. For relentless representation that you can trust, call Keith Short and Associates at 618-254-0055 today for a free consultation.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Our coverage continues of OSF Healthcare St. Anthony's 100-year anniversary open house, and we're here on this Thursday. We're broadcasting on a Monday so we can all watch it and have some fun. We got Jackie, we got Melissa in, and we got the Med Group. And this is really, I guess, one of the most used services within OSF Healthcare. Where should we start when we talk about Med Group overall?
Well, I think primary care is your first step to getting in the door and getting established with a primary care provider for your yearly, health screenings or some of the younger ones need physical exams. And then if you require any type of specialty services, the primary cares are able to refer you on.
Well, it seems like you all have a really good team of primary care providers and really just a great network to work in with OSF, especially with all the additions. I'm sure it makes it to where it's so much easier to be a primary care patient within the group.
Yes, that's true. We work we work really well together to make the service line real easy. It streams across all of our specialties and primary care. We kind of follow the same process, so it goes
super cool. Well, let's take me through your roles a little bit. Jackie, let's start with you. Take me through your day-to-day.
Well,
is it ever the same?
There are some things that are the same, but there are different challenges that we run into every day. There's a lot of celebrations we get to do as well. A typical day, we see anywhere from 100 to 180 patients
really
come through our clinic.
Wow.
Some of them are there for just their, regular follow-up visits. Some of them are establishing care. Some of them are coming in for lab work, or we also have a nurse clinic that is very nice, and our patients are able to get in with the nurses to do like blood pressure checks, or if they have maybe some warfarin that they're needing monitored. We have our anti-coag clinic as well. So we start our day just opening up the doors, welcoming in our patients. We get them checked in, and I just kind of help and try to remove those barriers for our patients, for our mission partners, and for our providers so they can focus on patients.
How long have you been at OSF?
I am going on my 6th year.
6. That's incredible. And Melissa, how long have you been over
10
here?
years.
10. Well, and now take me through the specialty side of things in your day-to-day as well.
Yeah, so we have 10 different specialties and over 2 different floors, and with lots of different agreements. So we have some partnerships with SLU, with Urology of St. Louis, so we're able to bring those specialties to us, to our community here.
What's that mean just for the folks that maybe are, kind of like me and aren't real into the medical, lingo of things? What does that mean just comprehensively for all of us?
That means that we try to provide as many of the services as we can here locally.
So we don't have to drive the 270 war zone.
That's right.
And there's been a lot of additions along the way, especially in your 10 years with bringing those in. Do you care to name a few or just remember some that have those partnerships that have happened along the way that you've been a part of and seen the merger?
Like I said, we have Urology of St. Louis, and we have doctors that come over from SLU. And
is that the SSM partnership there?
SSM
okay.
SLU, yeah.
Really cool. Well, and today, take me through just the open house. What have been the highlights for you two and just being out and not in the office for a few hours?
I think what's been nice is meeting the people who are coming through and seeing how many of those people don't have a primary care provider, a doctor. Some of them have told us, no, I don't have one, but I really need to. I need to find one local. One lady told us that she was coming from Springfield area, but going to St. Louis for her primary.
Wow.
So we're like, we have those services here, and she says, I didn't even know you was here. So.
It's incredible. Well, and when you hear that, though, and so many times, and we've had it with psych services and talking about, folks going through mental health battles and, other community organizations that a lot of folks just don't have a primary care provider. And now, this is a simple question, and someone at home is going to go, really, that's the one you decided to ask today, CJ? But what's the first step to really finding a primary care provider? How long does it take normally just to start that process?
Well, I mean, that all depends where you're going. Currently for us, for primary care, we have several new providers who have started in our practice. So our access is open. We can probably get new patients in within the week.
Really?
You may run into some areas where, you're looking for a primary care provider. It could take months to get in. It's just going to depend on the access. But for OSF right now, we're able to get you in usually within the week.
That's really cool. Well, and now, with OSF growing their services, like you said, and having those partnerships, has the efficiency of the office been able to improve because of having that all under one roof and under one, access point, truly?
Yeah, I think so. I think just being able to know where our patients are going to get certain services done. So when they do need that higher level of care, we have contacts at, let's say, SSM and SLU that we can reach out to and say, hey, we're sending you this patient. And then they make sure they come back to us so they can continue their care here.
Well, and see, that's what really matters is that true wraparound approach. So you aren't just saying, see you here in a few. You're able to really follow up and really able to help them on their medical journey, and that's so important. Before I let you go, what is the most utilized specialty? I know that's probably a tough question. Is there one that's more frequent than others?
I can tell you right now, our neurology office is very busy. There's not a lot of neurologists around, but we have added another nurse practitioner to help our neurologist out and help lighten his load.
It's incredible.
Yep.
Well, and then Jackie, before I let you go, what is the most important bit of information that someone could have, when they're making that choice on a primary care provider or just when they're calling the office and trying to get everything, going on their medical journey? What's the best bit of advice you can give?
Sure. I mean, you want to find someone that you're comfortable with. So sometimes, it's best to make an appointment to meet that provider and make sure that, you're compatible. But always want to make sure you have your insurance information. They're going to ask you, some pre-visit planning questions. You'll get a call about that. Just your medication list, your medical history, any pertinent information around your health care that would be beneficial.
Well, seriously, thank you both so much for stopping by, and it's really great to get some more insights on the med group and then the specialty services too, because they are important, the most important part for all of us to get our journey started, or just to make sure that we're doing everything that our primary care provider told us that we needed to do or probably should be doing.
Right.
Thanks for stopping by. We'll take a quick break. More coverage of this 100th year anniversary open house comes your way next.
Throughout all life stages, you need someone in your corner, guiding you on your health and wellness journey. At OSF Healthcare, that's your primary care provider. Your OSF primary care provider is there for every stage of life. Find a provider today at osfhealthcare.org/primary.
Not sure if you've noticed, but those advertised prices from the other dealers are just a bunch of blah, blah, blah. At Roberts Motors, the advertised price is the price you pay. And that, my friend, is great news for you. Don't fall for their so-called incentives that will leave you banging your head against the wall. Go with Roberts Motors. Prices you can trust and people you will like. That's the Roberts Motors way. And trust me, it's the way to go.
Has free checking become a thing of the past? Not if Liberty has anything to say about it. With 3 free personal checking options and even a free business checking account, free is alive and well at Liberty Bank. The local bank that gives you free checking choices and more cashing in your pocket. Bank locally, bank Liberty. For more information, visit www.bankliberty.com.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Everybody got somebody
Welcome back as we are celebrating 100 years of OSF Healthcare. And Zach, I'm just going to make this assumption. You were not around when it was founded.
I was not. That's very accurate. Great assumption.
Well, you know, it's been a great year for you guys. I mean, we talked about it at the North Alton Godfrey Business Council just a couple of days ago. We talked about it on the show. The magnet designation with distinction is one of the biggest things, if not, it is the biggest thing to celebrate, number one. But on top of that, a ton of awesome additions being made to the hospital throughout the year, too, on top of that designation.
Yeah, absolutely.
That's a lot to wrap a head around.
It sure is. Yeah, it's been great.
Well, filming in your role here with being president of the hospital, you've got to just be ecstatic and just seeing every team firing and going on all cylinders here.
Yeah, it's been a wonderful year. So I'm actually rounding out about a year.
You
here,
are, yeah.
Which is really, really cool. We have a lot of great strategies. I know big focus on cardiology services. We've grown that service over 120% in the last year.
Wow.
Our cancer care initiatives around lung screenings and different kinds of things that we're doing in the cancer center have gone up tremendously. We just did our mission partner employee opinion survey, which we were 89th percentile in the nation. So
really
highly engaged mission partners and team members here, which is fantastic. And then we're busier and doing more than we were prior year and even the year before. So
well, and this is what we were talking about. We just had oncology on, and we were talking with Dana a little bit about the low dose CTs and everything that you just mentioned. And you know, on top of that, like the wound care clinic, that's not too far off of the year mark too. There are the additions to it and the psych services that are being upgraded each and every couple of months or years. I mean, we used to have to drive hours at a time back and forth or wait months for some of these appointments in other area institutions, and we have it all here.
Absolutely, yeah. I mean, we set out and we set our goals to keep care local.
Yeah.
That's what we want to do. We want to keep care here in the Riverbend area, and we want you to only have to go to other places or across the river when it's absolutely necessary. And so we're stand by that commitment, and we want to continue to be that. You mentioned our magnet designation with distinction, which is basically there's 14 categories within magnet that you have to meet, and we exceeded in all 14 categories.
Just incredible.
So
and it's not like it's an easy category.
No,
ever.
There's 46 hospitals worldwide that have magnet with distinction. So it's a really monumental thing that the mission partners here were able to achieve, and I can't be more proud of them.
Well, now that you're rounding out your first year too, what have you just seen, and what has been different than maybe what you expected this role to be, just going in?
Well, I think for us here at St. Anthony's, it's we're really ripe for growth.
Yeah.
Because we have a highly engaged workforce, we have extremely smart and intelligent staff, we have some of the best quality and safety scores in the area. So we provide very high quality, safe care. We just need to grow in some of those areas that we know we can grow in, and they're areas that the community needs, right?
Mm-hmm.
We know that a lot of people are going across the river for cardiology services, cancer care, GI services, ortho services, and so we want to provide those close to home to make sure that they can get those here in a safe and quality way.
Another really unique thing, and I've been thinking about this just today a little bit because, my grandma worked ICU here for 20 years or
nice.
30 years, and it was a long time. And, I'm thinking, though, how many times do you guys work on a former nurse, a former, CT scan, someone that worked here at the hospital? And that, to me, is the story, too, because if someone works there, and they're coming back and going, no, this is where I'm receiving my health care, they know that there's something good going on.
Yeah, that actually happens very frequently.
I bet, yeah.
Because I'm fortunate enough to be able to do some patient rounding, and I also round in the waiting rooms on family members quite often. And,
that's interesting that you do that. That's cool.
Yeah, they say it all the time. I mean, sometimes that's where you get your best feedback, and they say it all the time. I come here because it's a wonderful experience, and I know I'm going to get the best possible care, and I know that they're going to treat me like family here, and that's why they come. And so that's, to me, is a huge reinforcement of what we do and why we do it.
What's your favorite part of a day like today where you get to not only have the public come in, but also have other members of the staff kind of walk around and get to reconnect a little bit too?
I like the camaraderie that it builds and the fact that we have people that are so engaged and bought into the mission and what we're doing here that they want to be a part of things even outside of their day-to-day work. We have 50 sisters here at the convent as well, so we're really blessed to have.
And just added 6.
Yeah,
that's incredible.
6
that's
new
a
ones
huge
as well.
number. Yeah.
And they're super engaged too. And so, like I said, 89th percentile on our mission partner engagement scores nationwide. We do Press Ganey as our company that we use for our opinion surveys every year, and then we take those opinion surveys and we refine things and we make things better. But we have super and high engaged folks here, people that want to be here and here for the right reasons. So,
well, it's got to be something unique too for admin and everybody that's on that kind of team that looks at those scores, because I'm sure whenever a personnel survey comes back here, everyone's like, okay, let's see how this goes. But whenever you get the sense, and you guys aren't locked away in an office.
Right.
You're actively there throughout the hospital, throughout the different buildings, and you're actively working with everyone. You're touching base, you're connecting.
Yeah.
So it's got to feel a little bit easier when those surveys come back and you go, okay, let's just see where we're at.
Yeah, I mean, that's what it takes. I mean, I look at my role as, it's equal parts strategy, communication, operations, but it's also equal parts community involvement and patient and staff centric, right? So I'm visible in the community. I'm visible with my team here or throughout the hospital. We have to have visibility with our system as well in Peoria, and so that's how we can gain a lot of things from our system level as far as where are we going to grow, what are our strategies and things like that. But when you talk about the community and you're out and involved in the community, you get to hear from people specifically, and so it's really just making sure that you're there and present and you're communicating to people as well.
Well, 100%, man. And, as we're wrapping up this year with OSF, we've had a great, couple of years talking with you guys, and now this year making it official and having all these segments. What amazes me is the fact that no matter how many times you guys will come on or you'll send somebody, we're still learning about something new.
Yeah.
And I'm sure that's got to be difficult, too, to manage, to make sure everyone still knows about the collective work already done and already put into the palette, and then the new additions that come, too, to make sure we're all still on the same page and understanding.
Yeah, absolutely, and just trying to find ways to grow. But it starts with, like I said, connecting with the community, because if we don't know what the community needs, we can't provide it. And God forbid people get sick, but they're going to need services. It's inevitable that people are going to need health care, and so we want to be there for them when they do.
We were talking when you first came in, and you were in more of a rural setting, right, in the hospital the last time around, or your last. It's kind of cool, though, to hear just from talking with you, that kind of rural setting attitude where it's, being friendly and communicating and being out in the community. For OSF to be in a little bit larger, I guess, area, that attitude still is the same. And I think that's why everyone just has that kind of notch up on a thought process. When we think OSF, we think good things.
Yeah, absolutely. And I think, too, it's when people come in, they're sick and they don't feel well. They're not at their best, right? And we have to be there for them. We have to be smiling. We have to be excited. We have to make this a place that is a place of healing, and it comes not only physically, but it's mentally as well.
Yeah.
And so we have to show up every day and be that person. And sometimes as healthcare providers, that's tough in and of itself. And so as leaders, we have to walk that walk too, but we also have to be there to lift our teams up whenever they're doing the hard work.
Yeah.
Whenever they're telling, the grandmother that she has something that she has to take care of health-wise, or when they're consoling a family member. It's very difficult work, and so we have to together as a team lift each other up so we can be there for others.
100%. And Zach, before I let you go, what's your final takeaway just on an event like this? What's your message to the public?
I think it's just that we're here and we're ready to serve the community. I mean, we are all in on our Keeping Care Local initiative, and that's what we want to do. And part of having this open house is to get people in here and see what we have. Mm-hmm. We have a lot of services here, and you can get very high quality care really close to home. And so stop by and check us out today. We're here until 6 o'clock. And so we're happy to serve.
Absolutely. And then one final thing, just because it's my job.
Yeah.
Can you tease us about anything to come next year? Is there any exciting developments in the works?
Yeah, I mean, continued growth in cardiology is going to be huge. Wow. We are adding more and more procedures in our cath lab and things that we're doing here so people don't have to travel. Lots of different things around venous insufficiency. We do artificial pumps here, putting in pacemakers, do a lot of different things around cardiology. And then cancer care. We are looking to enhance services around benign radiation, which is for like osteoarthritis and things like that aren't cancer. cancer, but radiation actually helps with pain and other things for like osteoarthritis and various different things. And so we are really looking to improve that quite a bit as well.
Well, and this is why I love the conversations too, because with being local media, we don't have the big corporate arm, and with you guys at OSF, when you're adding things like this, but also supporting community things, where you're supporting the local media and you're supporting the River Dragons and doing all these North Alton Godfrey ventures, I think that's what makes it so much special too, for the community to kind of be a part of this milestone and celebrate all these distinctions and the advancements in medicine here in our backyard.
Yeah. Nope, I think you hit the nail on the head. I think, we have a wonderful community here. We are really blessed to be here. And I just think that, being in a community like this, you have to also engage people, and that's what we're doing.
Well, Zach, it's always great talking to you.
Yeah,
And I know
too.
we'll get you back in the studio sometime soon.
Happy to.
We'll take a quick break, and more of our coverage of the 100th anniversary open house right here at OSF St. Anthony's continues next on RiverBender, Roku, and anywhere you watch the show.
Thanks.
Perfect, man. Thank you.
Yeah, no problem.
With over 20 years of experience, Wilson's Tree Service has the expertise to handle all of your tree care needs. Licensed and fully insured, their team of experts are dedicated to providing reliable service. Plus, with a 24-hour emergency service line, Wilson's will always be there for you. Don't risk tackling that timber by yourself. Trust the local professionals at Wilson's Tree Service. Visit treeservicealtonil.org to get started today.
Discover Del Mar Public House, located in Godfrey's historic Clifton Schoolhouse. Enjoy bold flavors like homemade falafel, fish and chips, and rotating pasta favorites. Relax with local beers, half-price wine bottles, and summer poutine nights. The only thing missing is you. Open Wednesday through Sunday. Del Mar Public House, where great food, drinks, and friends come together. DelMarPublicHouse.com.
Do you need to declutter your space? Time to call me, the Queen of Junk. Since 1993, we have grown to be the leader in residential, commercial, and property management junk removal. At Sparks Junk Removal, we are eco-friendly. We recycle, donate, or repurpose items back into our community. Trash is our last resort to the landfill. Plus, with our all-inclusive service, our crews handle everything from labor to lifting and landfill fees. Give us a call or visit our website, sparksjunkremoval.net, to reclaim your space today.
When I got in the car accident at the ER, they gave me a prescription of hydrocodone. And over time, it took more medication to mask the pain. I moved over to drug seeking and found heroin and fentanyl. I went to the Centerstone rehab facility, and it was the best decision I ever made in my life. I have my own car, I have a job, there's nothing holding me back anymore.
When you need a project done right, on budget and on time, trust Gillahan Concrete. Gillahan handles every kind of project, big and small. Commercial, industrial, residential, from room additions and garages to patios, driveways, and more. Gillahan brings quality and experience to every job. Family owned with over 30 years of service to our community. Call today at 618-781-3914 or visit GillahanConcrete.com.
Accidents happen in a heartbeat, but lives change forever. Whether it's a car crash, workplace injury, medical malpractice, or wrongful death, you don't have to face the consequences alone. Keith Short and Associates brings over 33 years of experience and a reputation for fighting fiercely for your rights. For relentless representation that you can trust, call Keith Short and Associates at 618-254-0055 today for a free consultation.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Hello, it's me.
Oh, my friends, we are wrapping up the 100th year anniversary open house at OSF St. Anthony's Health Center. We are taping this on the day it happened, October the 23rd. We are running this October the 27th, and we're wrapping up the show with Frances. How are we doing today?
I'm well, CJ. How about you?
Oh, doing great. It's great to have you back on the show.
Thank you. It's good to be here.
I got to break the fourth wall and just look you all right in the eye. We talked about osteoporosis, as Frances politely told me last time.
We did. I work in the physical therapy department.
Well, and as the manager of rehab services, take me through your day-to-day. What's that look like for you?
Oh, well, I have 17 people that I work with, and physical occupational speech therapists. And some work here at the hospital, seeing patients in the hospital, and some work at our outpatient clinic in the Alton Mall.
Wow. Well, and now with that being said, too, you've been here for a cup of coffee, to say the least. 22 years.
Yes, sir.
Take me through how you guys have grown in your rehab services over the 22 years.
Oh, it's changed a lot.
I bet.
Yeah, it has. We used to be over at the old St. Clair's Hospital building for our outpatient therapies. And then when they closed St. Clair's, they built us a beautiful facility out at the Alton Mall. And we love it there. It's easy to get into. We have a huge space and lots of great equipment.
Well, and so many times, and it shows my lack of medical knowledge too. I think collectively as people that aren't medical professionals, we think of rehab or physical therapy, or rehab as physical therapy, as after surgery getting the hip back right. But there's so much more on top of that when it comes to the rehabilitation services. And you guys have a really good team of talented individuals that really do help. Fill me in on you mentioned a few of the different departments when it comes to rehab services. Can you take me through the gauntlet?
Sure. We have the physical therapy department, which is our largest, but we also have a great service with occupational therapy and speech therapy.
What's occupational therapy?
They have a huge range of patients that they see, starting with pediatrics. They see a lot of children with autism. Wow. They see children for feeding disorders. If a child's having difficulty with certain textures of foods, or not being able to tolerate certain things, or only picky diets, you know. They also work with people that have had arm or shoulder, hand injuries. They work with patients that have balance problems.
Wow.
Parkinson's patients.
So pretty well-rounded when it comes to...
they see a lot of different varieties.
And it seems like you have to be pretty good at adapting and knowing your craft whenever you're working in that department.
Yeah, they're great because they'll switch back and forth
from
seeing a child to an adult and then back to a child. So takes a lot of talent.
Well, and this is one that, I just think of on the top of my head, as we're talking here. I'm sure that's quite a mental balance, too, for your staff if you're working with, a younger child, and then we're going right up on to, middle age. How does your staff balance that, or how does one balance that when you're working with different age levels?
I think it just comes with experience. They're all very well experienced. Most of them have been in our department probably 10 years or more, and they just have that ability from their experience to know how to interact with people of all ages. And it's like all of us, when you work with the public, you learn to some people you interact with differently than others.
Well, and today, take me through your experience with the open house and just your thought on it. Was it a good experience for you?
It's great. It's great. I always enjoy having the public around and trying to share with our services with them, and trying to show them that we can help them and we want to help them.
Well, and too, for somebody who wants to learn more, let's say that they're maybe a surgery's coming up, and I haven't had many hips or knees done yet, but I know they'll be coming soon, like everyone. And I don't know how that process works, but if if someone's going, man, I need to get this work done, or I need to get this started, what's the best way just to call the office and see, through our primary care, obviously, and all of that, but what's the best way to see if we can go see you guys after that surgery or during that that rehabilitation duration?
We recommend that you get a prescription from your doctor, a referral, and so just speaking with your doctor about what where you want to go for your therapy, and it's always the patient's choice. So
that's really cool. Well, and take me through a little bit of your team. Does everyone get along and fire on all cylinders pretty well?
Oh, they're a great team.
Good.
They, like I said, they've been a lot of experience there. We have some new therapists that have been here just working a couple years, and we have some that have been working over 20 years.
It's incredible.
Nice mix, and what that does is they collaborate well together. The new ones the new ideas, but the therapists with more experience share their
tried and true.
Exactly. And they mesh well together.
How incredible. Well, and now have you had a chance today to maybe see someone that you used to work with that's come on in or stop by?
Have,
no kidding, that's awesome.
Yeah. It was someone that we used to work in home care, and then actually she ended up coming to therapy for a while. So it's great. Yeah, see people you haven't seen in a while.
What's your message to the community as we're wrapping up here, Francis, just about OSF's 100 years overall, and then I'll ask you to wrap up with some thoughts on the rehab services.
Sounds good. OSF has evolved over the years, as all healthcare systems, but I think they truly have placed the patient as the center of their care and want people to know that always when they come here, that person is special, and we want to do all we can to help them.
Absolutely. And then your final thought, just for anybody who wants to know why OSF Rehab Services is the place to work at and the place to go receive care.
As I've said before, our therapists are awesome and they have a lot of experience. We also have a lot of different programs from a 2-week-old baby to a 100-year-old person.
It's incredible.
Mm-hmm.
Well, Francis, it's always great to talk to you, and seriously, with you and the entire team at Rehab Services, best of luck. Now you got another 100 years to go.
We do. We're ready.
And thanks for stopping by.
Thank you, CJ.
We are out of time when it comes to our recognition of OSF's 100 years at the open house celebration, but thank you to all of you that have been a part of this broadcast today, who've rewatched it, that interviewed with me on this Thursday. Here's to 100 more years of OSF. Until I talk to you again, try your best to stay out of jail.